Hi, my name is Rachel Cortez. I'm filming this for my class, for my assessment of the abdomen, the focus assessment of the thorax, lungs, cardiovascular, and peripheral vascular. Hi, my name is Rachel. I'm going to be your nurse today. Can you verify your name and date of birth?
Julia, 12/19/1980.
Awesome. And Julia, do you give me permission to record this exam today?
Yes.
Thank you. Okay, so what brings you in today? Are you just here for a general check-in?
Yes.
Cool. All right, so first thing I'm going to do is I'm going to visual my patient, get a good head to toe on them, look at their skin. Typically, we would have our patients in a gown, but for this video, I'm not going to make her undress. Okay, so what I'm going to do is I'm just going to touch some various areas of your chest to feel your breathing and make sure everything is expanding. Good. I'm going to put my hands on the side of here. Good. And what I'm going to do back here is I'm going to place my hands. I'm going to pinch the skin here, and what I want you to do is take a nice deep breath and breathe. Beautiful. So good chest expansion as well. I'm going to listen to various areas of your lungs from the front as well as the back. Breathe. Now I'm going to listen on your back. Deep breath. Beautiful. All lung area is clear with no adventitious sounds. So next I'm going to put my hands on your back, and you're just going to repeat the word 99. What this is it's showing that when you're talking, there's vibrations that come through that I can feel that there's no consolidation or any issues. So that you're getting air all the way through.
Okay.
Say 99.
99.
Good. 90.
99. 99.
Very good. Very good. And no issues with cyanosis. Everything is looking good. No problems with breathing at all.
No.
Any history of any breathing disorders?
No.
Beautiful. So next what I'm going to do is I'm going to listen to your heart. Again, I'm going to listen to various places on your chest, and then a little underneath your left breast as well.
Okay. Do you need me to lay down?
Nope.
Okay.
Thank you. So the first part I'm looking at is the aortic, which is the second intercostal space on the right. S1 and S2 notified. Now I'm at the pulmonic, which is the second intercostal space on the left. S1 and S2. Now I'm going to Herb's Point, which is the third intercostal space on the left. Fantastic. And I'm going to go to the tricuspid valve, thank you, which is the fourth intercostal space on the low end towards the sternum. Okay, and then I'm going to go to the mitral valve, which is the fifth intercostal space, about mid-clavicular, so I'm going to get myself measured. Fantastic. S1 and S2 were heard on all areas. Heart rate sounds good, no murmurs or any abnormal sounds either. Then what I'm going to do is listen to your carotid. So I'll do them one at a time so that we don't put too much pressure on your carotid and mess up circulation. Beautiful. Good. I'm just going to listen here. Very good. No bruises noted. All right, so now what I'm going to do is I'm going to palpate. I'm going to palpate around your neck to feel your carotid one at a time. I'm then going to palpate your other pulses that are going to come down your arms and to your feet as well, okay? Good, and then turn your hands over, thank you. Good. I'm just gonna feel your feet here. Very good, and if you could actually just take your shoes off for me so I can get your dorsal PA. Okay. So I'm just feeling for her pulse at the top. Beautiful. All pulses are equal bilaterally and they're at a +2. Push in. Make sure I'm not missing anything. And let me see your hands real quick. Good. No clubbing, no cyanosis. Fingers look healthy. All right, so now I'm going to examine your belly. So if you want to just go ahead and lay back, I'm going to put your feet up for you. Fantastic. And then if you could, here, let's move that, make that a little bit more comfortable for you. Thank you. If you could just pull up your shirt just a little bit for me so I could inspect your belly. Very good. Color looks great. You can actually see your pulse in your belly right here. Interesting. All right, so what I'm going to do is I am going to, the pattern is inspect, auscultate, percussion, and palpate. I'm not going to percussion on you today, but I will start in a pattern of the lower right quadrant and make my way around to make sure that I get all the quadrants to make sure that I can hear everything. So just relax, keep your belly nice and soft for me. Valve sounds heard in all quadrants. So what I'm going to do now is I'm going to palpate gently on your belly. I'm only going to push about 1 to 2 centimeters down. All right, so cold hands. Any pain? Good. Any pain? Good. Awesome. All right, so you can go ahead and sit up. Fantastic. And that's it. I did wash my hands before I came into the room with the patient, and I've also cleaned my stethoscope prior to coming into the exam room as well.